Hi, welcome to Better Health Together and our second opportunity to have a conversation. As you might recall from last month, I'm Learne Durrington and I'm the CEO of the WA Primary Health Alliance. Now I'd like to have a chat, just a brief chat about WAFA and turning 3. And before I do that, in the last week we were co-hosting a primary healthcare roundtable with the State Department of Health and the Sustainable Health Review, and in partnership with the Minister for Health, Roger Cook. And it was a great event because the voices at the table were everyone: hospital CEOs, emergency department clinicians, GPs, allied health practitioners, nurse practitioners, consumers. And as I was told by many people present, it was the first time everybody who has a stake in the broader health system was at the one table having a conversation. And the conversation really was, as a collective group, what are our key recommendations or indeed ideas and thoughts about the Sustainable Health Review and going forward, and what needs to be included in that roadmap or blueprint for health over the next decade. And we, of course, while we're Commonwealth funded, see ourselves as an absolute partner with the state health system, because health is everyone's business and, as we say, better health together. But it was clear at the round table that adage of a strife of interests pops up. And while there was great willingness to work together, it's clear that people need to sometimes let go a little bit and think of the broader system as we move forward. And there were many steps on the way forward. Just on that note though, turning 3, small celebration for us as WAFA, and we do have another 3-year contract, which is great news. We've done quite a lot in the last 3 years. We've built some foundations. For example, we have 120 general practices enrolled in our comprehensive primary care program. We commissioned about 300 services across the state, and we collaborated with a range of partners such as Rural Health West and the Mental Health Commission on joint planning and co-commissioning and so forth. So we've done a lot. It's a building block for the next 3 years and longer. So it's been a time for reflection for us. What do these next 3 years hold? And in a sense, some of those reflections are the same things that we would say about the way forward for the broader health system. So for us, it's about outcomes, both clinical outcomes and patient outcomes, and capturing that information well so that we can provide that to others. It is about sharing health data across the health system, so those of us that are planners and commissioners understand what it is we need to realign, where are the gaps and so forth. We're also really committed to pursuing integration locally through our place-based strategies. That involves health service providers such as WACS in country locations, or indeed in Perth, whether that's Fiona Stanley or Royal Perth Hospital. But it's about strengthening the connectivity between the wider elements of the healthcare system locally, so it's both easier to navigate, but also for people for whom access is limited, they actually get what they need. So thinking back to the round table, I was having this thought bubble about if there was no more funding available for health, if it was a static boom, not growing as it has been, what would we do? How would we start to shape that system so that we have medical neighbourhoods where healthcare is more accessible, that we start to respond to the changing health needs of our community, such as chronic diseases and living longer, and what would the system look like if we were building it today for what are the sort of new challenges we have. I think all of us could say we keep building on to the old system, new things, without actually starting to rebuild the whole. And the Sustainable Health Review, with the leadership of Minister Cork, and also our Commonwealth Health Minister, it's a great opportunity here, which I mentioned previously, to start to think outside the square about how can we do this differently, what would it look like, and for everyone who has skin in the game, both clinicians and patients, what do they see that new system might look like? Anyway, I'll leave you with that challenge. I'd love you to talk with us through Better Health Together on our Primary Health Exchange, so please go to our website, and I'd love to hear your thoughts, because this is a conversation with you, and as many of you might know, we believe no one part of the health system can do the sort of change we're looking for on their own. So we welcome your thoughts. Thank you very much. Till next time, take care.